All right, I think it is now 12:03. I think we can jump right in. Good afternoon, everyone, for joining us today. So, thank you. This is a part of a series that we're doing United Way and partnering with our impact partners to bring forward, the important work that they're doing and how, we work together collaboratively to really make an impact within our community. I'm happy to say that this is our fourth. Tour with NAMI of Racine County today. Welcome Michelle, who is their ED, and her team. She has several people here who work for NAMI and then some board members as well. So welcome everyone. Thank you for joining us and being part of today's conversation. Again, really the purpose for these impact tours really is to provide you all with this firsthand experience, to really learn the work that NAMI does within the community around mental health, and mental health awareness, and really fighting the stigma around mental health, and then also how they really work with United Way to help fight for the healthy education, the financial stability of every person in Racine County. So a few things before we jump in. I do share this before every impact tour, some housekeeping. We do ask that everyone keep themselves muted for the majority of the conversation. There will be a portion at the end where there is a Q&A. Feel free to unmute yourself then to ask any questions, or as well, feel free to drop any of your questions or comments in the chat box. We have a few United Way staff members who are monitoring the chat box and will bring up your questions at that time. And then also too, we do record each of these conversations and they are posted on our website. So you can go ahead and, visit the website to see past tours, and then also share it with anyone who couldn't make it today. So with that, I will jump into the actual Q&A portion with Michelle and her team. So first question for Michelle, what does NAMI stand for and what is NAMI's mission?
Okay, so NAMI stands for National Alliance on Mental Illness. And so national, our mothership, so to speak, is in Arlington, Virginia. The symbol, the logo that you see is respective of grassroots. And we have a very grassroots foundation. It was founded by 3 women actually in Madison, the national office. And our Racine office as well was founded in 1979 by 3 mothers who had adult children in the inpatient psych unit. And in a nutshell, they were feeling frustrated, blamed, stigmatized. This was back in the 70s, really focused on advocacy at the time, and has grown since then. So every area, every state has a NAMI. Also the Virgin Islands and Thailand have NAMIs. So we're really driven by the product of NAMI. And as romantic and community health based as I am with the grassroots movement, we're also really proud of the fact that everything we do is evidence-based. So no matter which NAMI you go to, you'll get a good, uniform, solid product. I'd say our hallmark really is the peer support model. So peers meaning, what we might call patients or participants. Here we're known as peers. So all of our support groups, our educational groups, a lot of our advocacy is led by NAMI trained peers with lived experience, either in ourselves and or a family member. And that really drives our mission and our 4 pillars of advocacy, awareness, education. And what's the 4th one? Advocacy, education, awareness, and what's the 4th one, you guys? Quizzing you. So we're driven by those models. Everything we do is absolutely free of charge to anyone who comes. We don't make formal diagnoses. We don't work with medications, with the exception of our teen group that is starting again. That is led by a trained facilitator, but everything we do, we're trained by NAMI. to do our
Okay.
peer support and our advocacy. So that would be one thing that I would want you to know.
Okay, so you were part of this much larger alliance.
Mhm.
Do the local chapters, do their missions differ from the national alliance? Are there focus areas, I guess, for NAMI Racine County?
Our mission is pretty uniform. Our focus areas might differ a little bit. So like, for example, when we work with United Way and we work with developing an educated workforce, we're mindful that mental health, for example, we did a program for businesses and for United Way for destigmatizing the workplace. And NAMI has an actual sort of a decal that you can put on and distinguish yourself as a wellness in the workplace organization that has gone through that. So while our mission may be the same, we work with really what the needs of the community are and what we're taught are the priorities. Yeah.
Nice. Thanks for answering that.
Yeah, thanks.
So the next question is, maybe you want to share a little bit about programming and kind of the goals. I know, as you mentioned, right, there's a focus for adults, children and families, support groups. So maybe you want to share a little bit in more detail about what those programs look like.
Sure. And team, feel free to add your specialty areas as well. So we do programming both on site and, since COVID, virtually and in the community. So gosh, I could talk for 20 minutes about this. So I'll give my nutshell outline first for the sake of time, and then anything you want a little more breadth with, I'd be happy to expand or bring our team in to talk. So we do peer support groups here. We do them for general mental illness. We do one for survivors on loss of suicide. So solos, it's called. And when we say survivors of suicide, that means we've lost a member of our family who has died by suicide. So a support group. The term is survivors. It can be a little, but in this respect, it means family members who have survived the loss of a loved one to suicide. And we do a team talk group that we're starting again. And we've got a family support group. We also do NAMI mandated classes, and those are given to us by NAMI National. We just finished an 8-week peer-to-peer class, and we had about 13 kind of graduates of that class from around the state. We did it virtually, and that just goes through different topics. It's really kind of an open forum, even though we're guided by an outline. It's very interactive, talking about support, identifying resources, working with oneself as a peer, telling our stories. So we're hoping to do that again, as well as our signature family to family course. Sherry, do you want to talk about ending the silence, since you're kind of taking the helm with that again with us with the school? So ending the silence, we often call ETS. So just so you're familiar with the acronyms there.
Yeah, took me a little while to learn the acronyms. I was like, what are we doing? Like, what, ETS, ASAP? I don't know what you're talking about. But now that I got a pretty firm grip on it, yeah, I think our programs are awesome. ETS, we go into the schools. Right now we're trying to work out our schedules with Racine Unified, and then I'm also reaching out to Kenosha Unified, because their NAMI is more volunteer based, so they don't have a lot of people on board to kind of do things. So we're just reaching out to them, see if they want to do a presentation. But anyway, ending the silence, we go into the schools. We're talking about going in on a freshman level. We definitely like to go younger, but right now we're taking what we can get, to talk about the signs of mental illness, how you cope with mental illness, supporting someone with a mental illness. We use it. All of our programs, I believe, are based on personal life experience. So we share our stories, and we try to focus. We try to take the parts of our stories that are most relatable to the kids. So like in my presentation, I talk about what I felt like in high school. And reasons you don't get help because of the stigma of mental illness. And then, like I said, just being able to reach out for help, being able to identify who needs help. Because, you know, being a teenager is tricky. And then, you know, you don't know what is normal teenage behavior and what is a cry for help. So we kind of try to cover those bases so that the kids feel more comfortable coming to an adult, and because we're not just an adult, we're somebody who has issues like they have. You know, we're concerned about the same things we are. So ending the silence is awesome.
Sounds like a great program.
Yeah.
Awareness, you know, it's very important. Can you maybe share how individuals can sign up for services? You know, whether it's the peer-to-peer group, you know, how do people get in touch with NAMI, and, you know, if they're suffering from mental illness? And
yeah, I am from day one have been an advocate of our website. Our website is just a wealth of information. If you go on there, you know, go to NAMI Racine County. There are a bunch of tabs at the top, and you'll be able to find all of our listings for our support groups, when they meet. You don't, for any of our support groups, you don't have to sign up. You don't have to, you know, there's no cost. There's, for the online, for the virtual support groups that we've started because of COVID, and we've continued some of them, you do have to contact us just through our regular number. You can contact me, Michelle, anybody, and they will send you a link to be able to access the Zoom meeting. But other than that, like for our in-person support groups, you just show up.
okay.
Yeah, and so it's really easy. But like I said, with the website, it's even easier to access anything you need at your fingertips. You just go and click on the tab that you need. We have all kinds of resources, connections in the community, as far as trying to find a therapist, you know, if you're interested in more than just a support group, not just a support group, but if you're interested in finding a therapist, a counselor, where to go for emergency shelter, where to go, things like that. We have all of those resources on our website. So
Okay, so nobody needs a referral of any sort from, okay.
Nope, you just show up.
That's great. You guys invite everybody and are inclusive in that way. So that is great. Michelle, can you maybe share a little bit about how you've partnered with local government and law enforcement, and kind of some of the programming around that?
Oh, sure. It's kind of a two-part question. So our pillar of, I'm thinking of advocacy, and I know Pat, we worked on this summer. We met with local sheriff's department, the campus, the jail minister, the social workers, some of our staff, to talk about things that are going on in jail as far as mental health services, the need for crisis responses prior to that. So what's available in community? And we're kind of having a series of conversations with that. Right now, actually, you caught us at a good time. So part two of that answer is we do a program, another acronym called CIT, Crisis Intervention Teams. And that's a week-long training. It's a NAMI signature program, again, strictly for law enforcement. We're right in the middle of that right now at Gateway. Technical College is always kind enough to host us. They're day-long events for 5 days. We go through a series of, they do ride-alongs. We talk about de-escalation. We have panels of persons who have been through the system, so to speak, and their experiences. And they do real-life scenarios with actors as far as de-escalation, crisis response. So those two things I've thought of immediately. Also, when we talk about crisis lines, so NAMI across the board is not a crisis line, so we're not open 24/7. We do have, you know, a resource line and people that can help with support. We do work very closely with Racine County Crisis Team. So you'll find if someone does call us and they're in a crisis and they get us at like in the middle of the night, they think they can call. Obviously, there's that prompt to call 911. And I'm going to go two ways with this. The other part, and we're grateful to United Way. I always think of you when we have to do this. There is a feature that we can use on our phone where the Racine crisis line is just a button away. Or if someone calls our line in the middle of the night and needs a crisis center call, they just press, I think it's 7 or 8, and the call goes directly to the crisis line. So we have a very close working relationship with them. Also, one thing that the community really has taught us, so I mentioned CIT trained officers who go through this week-long training and then they actually graduate. NAMI National recognizes this, and there's a certificate and a pin that they get. But more importantly, what I would want anyone listening or viewing to know is that, okay, then what do we do with that? And I'm amazed at what our community has taught us. I want people to know that if you're in a crisis and you call 911, you can ask for a CIT trained officer, and they will send them out to you. So dispatchers go through a training as well called CIP, which is Crisis Intervention Partners. And that's something we do for crisis workers, just 911 dispatchers, EMS workers, security guards, so that they know that. But I'm amazed at how many people, and I didn't know this till I was in my 40s, that you can call and request a CIT trained officer and they will come. And we've gotten feedback from a few people in the group that have said they have done that, and it's made a wealth of difference. So the programming is only as good as our community members who need to access the service, and is it there and is it known? So I would say out of anything we talk about today, from what I've been learning from people in Racine, is that they want to know that this is an option.
Yeah, that's it's crucial, and it's very important. I was not aware of that until today and just now. So thank you for sharing that. And I'm sure many people on the call as well are not aware of that, right? So oftentimes you hear, police, law enforcement share, how they get so many calls with people who are having, a mental illness situation, and how do they navigate that? So that's great information. So thank you for sharing that.
Thanks.
So a big portion of what NAMI does, right, is around advocacy. Can you maybe share how individuals on today's call can help with fighting the stigma around mental illness?
I mean, I think just helping us get the word out. I don't know if anyone else here has specific ideas, or Pat or Mary, who have been here longer than I have, if you've got ideas. But definitely we're sharpening our social media. We're working with NAMI National to be trained on our helpline so people can call and get answers to resources. And I always tell people, I understand when I hear the shaking in their voice, that was me. And so not only is it support, which is our fourth pillar, but it's really a means of advocacy, of letting people know, I've been there. I felt like I couldn't talk about it, but now I'm at a place of strength. And I hear that shaking in your voice, or I see your knees shaking as you walk up the stairs, and we've been there. And the more that we can have a platform and have partners like United Way that help us get the word out, that help us teach people to use their stories. We do have a program called NAMI Smarts, which is completely grassroots advocacy based. And that's for people who really want to use their voice and make a difference. So we have self-advocacy, but then the big picture advocacy. So how can we, across political aisles or no politics, get the word out about mental health parity with insurance laws, decriminalization of mental health in prison, mental health courts. The list could go on, but there is such a need for people to use our voices and our stories to advocate for one another, either on an individual level or at the society level. And NAMI is such a great platform. We walk people through NAMI Smarts training, which we're hoping to offer again very soon. I'd say that's probably our biggest platform.
Yeah, and I know of you, earlier this month, you all did some community events around, right, advocacy and helping end the stigma. So I think you all, it was Mental Health Week, correct?
Yep, we get a whole week, yeah.
Yes.
Mental Health Awareness Week, yeah.
Right.
I wanted to add something to what Michelle had said. And for me, in my opinion, using your personal experience, just talking about mental illness, like it really is no big deal, because it's something that's common. It's something like, hey, my cousin has diabetes. Okay, well, my cousin has bipolar too. You know, I think on a personal level, just sharing that, just being so matter of fact about it, to where people just become accustomed to hearing us talk about it. Because the stigma, I still, you know, I believe we've come a long way, but we still have a long way to go. By just being able to talk about it, like, this is just part of who I am. It doesn't define me. I don't suffer from it. It's part of who I am. And I feel like the more normalized it is, the better off we're going to be in the long run.
That's a great
So,
point.
yeah. So if you know, like, hey, you know, my mom suffered from depression. Did that stop her from raising 4 kids and, you know, having a household that she was the head of and doing a great job at it? No, it didn't. You know.
Yeah. That's a great point that you bring up, you know, the similarity between like mental health and physical health, right? Not often are people shamed for sharing their experience with diabetes. So I think we, you know, at some point, hopefully people are not, you know, and not to say that, you know, people are always shamed, but, you know, there is that stigma to mental health, so, or mental illness. So thank you for sharing that. I want to pivot a little bit and talk about maybe how services have looked over the last 18, 19 months, right, with the pandemic.
Mhm.
Have you seen an increase in the need of services? And I know you shared a little bit how you all have provided this virtual space for individuals. So Michelle, maybe do you want to share a little bit about that?
Yeah, I mean, we are offering virtual support groups in addition to in-person support groups. But I think more importantly, yes, there is a need for that. We had a strategic planning retreat this weekend, and for any of you who were there, one of our board members, who's also a practicing nurse practitioner, a psych nurse practitioner, brought up a really interesting point about the need of mental health services in the pandemic. So many of us know that there's a shortage of psych providers in this area to begin with. And she was talking at this meeting that they have a referral list of 600 people just in one system, one group of psych providers, outpatient in the community. So that speaks volumes. At the same time, our support groups probably run, looking at my fellow facilitators here, probably maybe 8 to 10 at the most is considered like a really solid full support group. So there seems to be this divide of people who are on this referral list who need services, and NAMI with just having these small groups and doing a lot of marketing and a lot of, you know, the anti-stigma work. And so I think our approach really, again, what I've learned from providers and the community is, how do we reach the people that are looking for referrals or need support during the pandemic? And these are just the people who have reached out. So I worry about people who maybe are isolating a little more, you know, people like me who are social, who for whom isolation and lack of social structure can be a big trigger. And so I guess our biggest question is, yeah, we realize there's a need. We kind of take for granted that we're here, but I'm still surprised how many people don't quite know that where NAMI is or what we do. So I would say, yeah, we're aware of the need. There's always a need. We always, I think, feel like we're not doing enough. So anything we can do to reach people who need services or are on a waiting list or are waiting to be referred, there's always a seat at the table. And
Great.
our phone lines are always open. So
Thank you for that. Before I open it up to participants that are joining us today, I have one other question. How can people really help NAMI at this point? I know you've kind of hinted to some things, but what are some call to actions that you would like to put out to everyone today?
Advertise for us.
Advertise.
We have flyers that are available that list all of our support groups. If you want one, I will send you one. You can post them on your personal Facebook page. You can post them on your Insta. You can make a really cute TikTok video with them. We don't care, just get the word out there.
Okay. Any other calls to action?
Definitely, I'm sorry, I was reading the chat. Yeah, definitely, I really envision having an army of NAMI trained volunteers so that we can go out to meet schools for ending the silence, so that we can offer, there have been opportunities to go into Western Racine that we've been taking advantage of, but we're only a few people. So when we say grassroots, we're really a small group, even though we've got support. We really rely, volunteers are the heart and soul and bloodline of NAMI programming. So anyone who would like to volunteer, particularly with presenting groups or facilitating programs, we would be more than happy to have you.
Great, and they can visit your website to sign up, correct?
Yeah, and I'll put my, yeah, we do have paper materials. I was actually looking at the wall because I have them taped right by my phone here. So I was sort of looking, but I will definitely get you a paper copy with the numbers so that you can give them to the community. Yeah, that was in the
Great.
chat there. So.
Michelle, you might want to also mention our membership drive.
Sure. Yeah, you want to do that? I want to give you a chance to talk and meet everyone.
Sure. We're about to launch a new member drive as well. And we'll be both encouraging our existing members to recruit new members, as well as reach out to the community at large. And we're also taking steps to kind of strengthen our volunteer training and onboarding process so we can really actively incorporate new members and volunteers into the various programs and initiatives that have been discussed here. So, we're trying to get full alignment. And just to briefly add on to Michelle's comment regarding our strategic workshop, I think our board has concluded that really we need to continue to focus and accelerate on our awareness efforts, and also look for ways to work with other community partners to amplify our messaging. So obviously our work with United Way would be one example of that, but we're planning to be rather intentional with several of those partnerships in the upcoming years to further amplify the message, to make the community aware of the services available and initiatives that we're undertaking. So
thanks for sharing that, Pat. So at this point, I know we're at 12:30. I want to open it up to any questions that anybody may have for the team here. Tracy, I believe there were a few questions in the chat box.
They were all answered by Sherry and Michelle.
Oh, awesome. Thank you. Otherwise, yeah, feel free to unmute yourself if you have any questions for the team.
Yeah, and if you I put my email address on there. So if you have any questions, if you would like a copy of our support group list or numbers for crisis lines, things like that, shoot me an email. I'd be glad to get it out to you. I can get it out to you this afternoon.
Great. Well, if we don't have any questions, again, I just want to thank the team at NAMI for sharing the wealth of information here today with everyone. I know I learned a lot about not only what you do within the community, but the resources that are available. So thank you so very much for joining us. Again, I do want to call attention to kind of their call to action. They are looking for volunteers to really help further their programming within the community and services. Also, helping try to end to help end the stigma around mental illness is very important as well. So with that, I do want to again thank everyone, and we will follow up with a thank you email with some more information about NAMI, as well as our next upcoming impact tour next month. The month of November will be talking to Lori Riffer, who is a United Way staff member who oversees our VITA program, and we'll be learning a little bit more about the Volunteer Income Tax Assistance Program and how you can get involved. So with that, again, thank you all, and I hope you all have a great afternoon.
Thank
Thank you.
Thank
Bye
you.
now.
Appreciate the opportunity.